Hey guys, welcome back to Balance with Dr. Nathan Wooten. We got a whole bunch of stuff to talk about today, including herniated discs, bad posture, all kinds of other cool stuff. Hey, so the first question is, hold on, I'm looking at this. Somebody asked, what is a hernia disc? Hernia
disc. So hernia and a disc don't go together, but a herniated disc is what we have. And that's when a disc that's in our spine here, these discs are little kind of spongy shock absorbers between our vertebrae. A herniated disc is when part of the disc bulges out. We've got the outer ring is the annulus fibrosus. Inside is a nucleus pulposus. It's got proteoglycans 1, 2, 3, and 4 in it.
Oh, stand by. So,
don't follow that?
No, you need to explain it like I'm a fifth grader.
Fifth grader. Got just the thing to explain that.
Sweet.
Thank you.
Donut.
A donut. So these discs are much like a donut. The outer edges are more solid, more firm. The inside, the tasty inside filling, is more of a jelly type thing. So What happens is if we have too much pressure down on that, it squishes out, and that is a hernia.
Wow.
Right there, herniated disc. You know, you've got me saying it. Squeeze, that's a herniated disc. That cracks on the outside, pieces slough off. It's just a mess. And that inside gel will hit these nerves. That causes pain down the leg, which is sciatica. And it can cause just all kinds of pain and issues there. Weakness, burning, numbness down the leg.
Huh. Yeah.
That's good. Now, so that's a herniated disc.
Gotcha. And that can happen on any disc, or where does that typically happen?
It can happen on any disc. We've got 26 vertebrae. We've got discs between them. It's spongy. A lot of people will have it in the neck. That causes pain and numbness down the arms. It doesn't happen so much in the mid-back, but definitely the low back. The way we curve forward here, naturally over time, we get more and more pressure on the front here, which pushes the discs, squirts them back into the nerves there, and that causes the pain down the leg.
Got to hand it to you. You have a really good grasp of analogies.
Thank you, Tim.
Okay, so next question is, this is kind of a generic question. How can a chiropractor fix or correct bad posture?
So what a chiropractor does, all of our vertebrae should be in a normal alignment here. All of the vertebrae should be stacked up like a Jenga game. Jenga game we've talked about before. If they're all lined up and on top of each other, we have good stability, we have good motion. What happens is over time, the vertebrae get shifted out of place like this, like that, and like that. That creates a lot of unstable structure in there, wiggly jiggly spine. So What we do is we can push those vertebrae back into place. Kind of looks like that. Gently get them in place with a chiropractic adjustment. That creates more balance, more stability in those joints. So that can actually help increase posture. If they're out of alignment, that actually, you can see that tilts the spine. So you'll see, like in scoliosis, for instance, there's thoughts that a shift here will create more scoliosis over time. Degenerative type process. If we get it early enough, we can keep them lined up, then that will help create a stronger, straighter spine.
Cool. So tell me where does the cracking take place? I don't see anything cracking when you put it back. What is
right?
And are we cracking?
We're not cracking. That's a common misnomer. We crack the spine or pop the spine. It's not a case at all. These little joints here are wrapped with lots of soft tissue. When they get out of alignment, they get a little air bubble in there. Nitrogen gas air bubble.
Gotcha.
When we put them back in place, that pops that little bubble.
Okay.
Kind of like popping a blister.
I see.
That's the pop that you hear.
So you don't want that bubble in there, is what you're saying?
Don't want the bubble in there.
Gotcha.
Yeah.
That's cool. So that's cool. So when I hear about people cracking their backs, there's nothing bad that's happening.
Get on a soapbox with that. I don't like popping your back or cracking your back. So the profession has gotten kind of, it's gotten kind of fun about it, and they've gotten lazy about it, but It's not where I'd want it to be. So we do an alignment or a chiropractic adjustment.
Awesome, cool. What's the best technique for a lower back pain? that you guys like to do?
The most common, so there's a ton of different techniques. There's diversified, Gonstead, upper cervical. There's just this whole thing. Yeah, they're all just brands and types of adjustments, styles of adjustments. Really, the best one is what works for the patient. How about that for an answer? So, the most common is called diversified. It's what most of us use most of the time. For low back pain, if the vertebrae are twisted out of alignment in the spine, in the low back, one of the most common is what we call side posture. The patient lays on their side, we turn them a little bit and give a little push this way. That lines them up.
That is a lot of, that's not too much stress?
No, not at all. Most people, we hear all kinds of good words. So it gives lots of relief. As soon as that little pop is heard, that noise is cavitation.
Can you show me that again? Just how much you're adjusting, how much you're moving?
So what we're doing, if you're laying patients on their side, we twist them a little bit and then we push up that way, and that pops those little joints back into place. It lines up the vertebrae there.
That is incredible. I had no idea how much movement was going on there.
Most patients afterwards, they just lay there and close their eyes and they want a little blanket and a teddy bear, and that's how good they feel afterwards. The other techniques, there's some where they're face down, the table has a spring-loaded piece, and we give a little push, and that drops the vertebrae back into place. There's all kinds of little techniques to go, but those are the main two.
So what I'm hearing you say is based not necessarily what the patient, well, it is what the patient needs, but where the vertebrae are, what needs to be adjusted, it dictates the technique.
Absolutely. Yeah, we don't just grab them and rip them and twist them and all that. We can find which vertebrae specifically is out of place and work on that specific vertebrae and just tweak that one, like a loose bolt. We can just fix that one loose bolt.
Nice. So what do you think, Eileen? And why do you call her Eileen?
Well, she used to have 2 legs. Her name was Irene, and then one leg went missing. So now she's Eileen, and she works at IHOP. She has a twin brother named Bonaparte, and they just they're a little old. They're a little long in the tooth, but it's not real humorous. But you have to be stern with them, and you have to be a little mental.
Oh my gosh. Okay. All right, we got it.
It's jaw-dropping. It's really jaw-dropping.
Well, so I noticed she's kind of missing a jaw here a little bit.
I took her fishing. I took Eileen fishing one time, and one-handed, that's kind of a task. But you know what? She caught a fish that was this big.
Oh my gosh.
So, yeah.
Okay, moving on. So when you make an adjustment, how do the adjustments last? Or how long do they last? How does that all work? Because it seems to me, you make that adjustment, person's going to get up and just walk away, and things are going to go back the way they were.
Right. So there's a long process, and sometimes the adjustment will hold for a really long time, like weeks. Some patients I see weekly. Some patients I see every other day. It depends on the acuteness of what's going on in their spine. If they've never been to a chiropractor, we usually start with twice a week for a couple weeks, and just because that repetition teaches the body where to be.
Sure.
All of the ligaments and muscles have adapted to whatever position they've been in. So good old Eileen, her ligaments and muscles are all adapted to her twisted up body. She would need a lot of work. Right. So when we get them in place, it takes the body immediately starts to adapt to that new position. It just takes some time. So how long it lasts, it depends. I always give homework for people to do exercises and stretches to help facilitate quicker healing, quicker stability. Those that work out and are more active usually do better and quicker. However, those that are crazy sports people I usually see quite often.
Right.
Because they're a little reckless. So,
gotcha.
Yeah. To be honest, these puns really are fun.
Sweet. Okay, let's talk a little bit about, you were talking about ligaments. And I've heard the term MCL or ACL, somebody's torn their ACL.
Right.
Kind of talk about that, ligaments, in a way that I can understand it.
A way that you can understand. If only I had a prop I think there's a prop.
Literally?
Literally.
Sweet.
So all of our ligaments and tendons are twisted ropes. They're braided ropes. And with an injury, part of that has gone past its stretch point and it's gotten torn. So I'm going to make a torn up ligament.
Wow.
Just like that. And then so in its original form, it's really solid and strong. Gives a lot of good stretch, but when it's like this, it hurts. There's lots of inflammation in there, and there's just not the stability. Oh, dang. That's a complete tear
Okay.
of a ligament. Let's do the rotator cuff. An MCL is in your knee. That's a medial collateral ligament. And you get all this stuff too when you tear ligaments. You get junk and dust that comes out from these braided ropes tearing. So they will heal, they will regenerate. It just takes time because there's not a lot of blood supply to the ligaments. So we have to be tender with it. We have to gently hold it together. We have to maybe sling it or splint it and let that joint and the ligaments regain the integrity that they should.
So just kind of, are you talking about like some of the knee braces I see people wear? Mm-hmm. Awesome. So the knee braces kind of help with what, stability, or just
it's stability.
Hold that in
what
place?
It does is it takes strain off of those joints, off of the ligaments, so that they can actually have time to...
Are you seriously eating a donut right now?
You want some? Yeah. You can have some of that. It takes time for those ligaments, those threads, to come back together, and when they first grow back together, they're kind of like wet paper towels. So a big re-injury is going back to work too soon or back to sports too soon.
Right.
That wet paper towel rips. This piece of rope went into the bar, and the bartender said, "We don't serve ropes here." So he went outside and messed up his hair, and he put a knot in himself, and he came back in, and bartender says, aren't you the same piece of rope? And he goes, "No, I'm afraid not." So the ligaments, it just takes time. So the braces and the straps help just relieve stress on the ligament so that it has time to heal.
Awesome. Well, I am so hungry. Okay. So let's talk about knees. So tell me a little bit about knees. I'm in my mid-50s, and I'll have a knee that just hurts for a long time when I stand up or when I sit down. Sometimes, like if I'm walking. And A, what's that all about? B, what happens when people get older with their knees?
Right.
And is there anything we can do on our own? So I asked you a lot of questions right there. So just run with it. Oh! Nice.
I need you to pay attention to this.
Oh my gosh.
So the knee is an interesting joint. I've heard a lot of people say that God didn't really have it together when he created the knee. It's just not a very solid, stable joint. Fastest, strongest knee joint is an ostrich, and their knee goes backwards from ours.
Nice.
Isn't that an interesting fact? So what we've got, and I'll show you on this part too, we've got cartilage down here on the tibia, and then the femur fits on top with more cartilage. When the knee is bent, it's supposed to wiggle a little bit. That's by design. So over time, what happens is, because that takes all of our weight there, all of our pressure there, through time, we gain a little extra weight, we become less active, and what happens is that cartilage just gets hammered and hammered and hammered and beat down. So it can get little tears in it. It can, like a little hangnail, it gets tears. It cracks like dried out plastic. What happens then, that causes pain, and that causes clicking, that causes the knee to catch. So one of the best things to do is just to be active, just to be up and walking every hour or so. Walk around for 5 minutes. We all sit in a desk too much these days. Right. So if we can get out, do a couple of knee bends, just 10 of them in a row every hour or two, walk around, stretch and breathe, that will help immensely the integrity of the knee.
So when you're talking about a knee bend, are you talking about going down to a 90 degree angle?
Nah, we just want to do just like 20, 30 degrees down.
20, 30 degrees down.
Yeah.
Why wouldn't you go all the way down?
It's too much. It's just too much stress for anybody to really go all the way down. It's just not easy to do.
So let's talk about that. So I've done CrossFit for a
Right.
while, and when we're lifting weights and we go down we go down 20 to 30 degrees. That's a no rep.
Right.
So a full rep is when you go down all the way and you come back up.
Right.
So what?
So
So you're saying that that's probably not the best
Not-
use of our body.
I'm not the biggest fan of CrossFit stuff.
Great.
They have a lot of good stuff. I'm not knocking them. I just think they're a little overboard on some stuff. You've got a ligament here that runs from the knee to the tibia, and it's meant to bend all the way. But I don't know that it's meant to bend all the way with 500 pounds on your shoulders.
Right.
And doing that type of a lift on that ligament, you can see how much it bends. It's just not necessarily safe and practical all the time to do that.
Well, especially, I mean, CrossFit is notorious for having people. I'm not dissing CrossFit,
Yeah.
but people do
There's some
get
injuries.
injured,
Right.
and I think a lot of times what happens is because of the repetition,
Right.
you lose your the form. You
Correct.
won't do something right.
Form is huge
Yeah.
for sure on all of that.
Yeah. So very cool. All right. So what can we do besides getting up and walking around? What can we do if you're getting up in age to maintain? Maintain our knees better?
Right. Good diet is always good.
Right.
Vitamin D, calcium, those types of things will help keep the bone structure good, keep the cartilage good. We need to be well hydrated. Cartilage it's supposed to be springy and spongy, so we drink less water sometimes, and that creates the plastic of the cartilage just gets more rigid. It's not as fluid as it should be, so it's more prone to injuries as well. Glucosamine and chondroitin is great. Glucosamine is the building blocks of the cartilage. Chondroitin is the train that carries it to the cartilage. So it's just kind of the building blocks of that, the Lego pieces.
Cool.
Yeah.
Awesome. Well, let's do that this way. All right. Glucosamine, chondroitin. Cool
Yeah.
stuff. Okay.
And that's a cap. Take a capful daily.
Oh my gosh.
I don't know, man.
Too much. Okay. So I love to pop my own knees. Let me show you what I do. I get down like this. Yeah, no, I'm going to do it. Oh, yeah, that was awesome.
Okay, so that's not awesome at all.
So kind of show me with Eileen's other leg. Oh my gosh, we lost a leg.
We lost the leg.
So yeah, show me what's going on here. What is that good?
Well,
bad?
we got to start off on the right foot first. Don't do that. Don't do that. It's awful.
Okay.
First of all, again, back to chiropractic, we don't pop things. We don't crack things. We adjust them. We align things the way they should be done. If you took your car to a mechanic and said, hey, can you just pop my tire back into place? I don't think that would be really good.
Right.
Like, can you do a 4-wheel alignment on my car? That's usually a good thing. So when you're just dumbly, and I don't mean that like low
It's okay.
education,
Yeah.
low IQ, when you're just doing that and popping your knee, what are you doing? There's no idea what you're doing. You're just creating motion, and likely what you're doing is popping the femur on the cartilage of the tibia. So that's grinding away, grinding away, grinding away. You have knee problems, huh? So from playing in the bigs. So what I would do is go to a chiropractor that can actually adjust the tibia with regards to the femur and get it in the proper alignment so that it locks and has even pressure and distribution of weight across the cartilage. Maintains the integrity of the cartilage.
Gotcha. So so this is bad.
Bad. Unless you're making firewood. Okay. Don't do it.
Awesome.
There's some splinter theories on that.
Oh my gosh.
But yeah.
Nice.
There are ways to adjust the knee, but doing a deep knee squat to create that is not a good idea.
Let's talk about what else not to do at home. So one of the things that I try to do every night, I know it's wrong and I know I shouldn't do it, but I'll try to crack my neck at night while I'm laying on bed.
Don't.
So why? I mean, I think that it feels good.
There's 2 things to not do at home. Talk back to your wife and crack your own neck. Please don't do
Nice.
that. So with each vertebrae, let me actually use this one here.
Okay.
With each vertebrae, we've got an X, a Y, and a Z axis. So the vertebrae actually rotate side to side. They can shift forward and backward, and then they can tilt side to side. So if you are pulling on your neck and doing this, there's no idea what vector you're using to get that vertebrae. You're creating a cavitation to pop, and what that likely is just like popping open a clamshell. It just pops it open. Over time, that's going to create more and more instability in the joints because they're being stretched further than they should be by doing that pop open thing. So when we do an adjustment, we're doing rotation, forward movement, and lateral movement. We're getting X, Y, Z all in the same motion of an adjustment versus you're just getting a lateral pop that just, again, it just opens up that joint, creates a lot of instability in that soft tissue.
So it may give me a temporary relief.
Right, because the body, you've been to a chiropractor, the body learns that a pop gives some sort of a release, so natural painkillers are released. Endorphins and enkephalins are released.
Gotcha.
Just like Pavlov's dogs, the minute they hear the bell, they start salivating. As soon as you pop your own neck, you start salivating probably, right?
All right.
Your wife gets a little tissue for you. So
Nice.
You're just teaching the body to believe something's good that's not.
Gotcha. Okay, cool. So what about coming behind somebody when they do this and pulling them up? What do you think about that?
Are you a licensed chiropractor?
No.
No. So it works. It's one of the more safe things that a non-licensed professional can do, but it's really just not
And you don't even want to demonstrate,
You
right?
don't, no.
Okay.
Yeah.
Gotcha.
It can be done, but it's just not so that mimics a technique that we're actually taught in school to get the mid-back, the thoracic vertebrae and ribs in place. It's kind of a reverse bear hug or a reverse Heimlich,
Right.
But it's just, again, it's just not, there can be damage. There can be ribs broken. There can be ligament damage. There can be all kinds of soft tissue stuff. So it's just better up to the professional that's licensed and insured and,
Gotcha. So now we've talked about things that we shouldn't do at home.
Right.
Why don't you tell me some items that we can do that are actually beneficial and that don't hurt the body?
Right. So stretching is one of the biggest things to do at home to help keep everything limber. As we age, even if we don't age, we just get stagnant in our position. We get at the desk, we look down at our computer and phones, and so we need to stretch to keep things limbered up. So stretching the head side to side, stretching it right and left, and stretching it back. Those are all good things to do for neck. I do not recommend looking down and stretching down because we do so much of that already that everybody's getting straight necks. Their neck should be curved like this. As we look down, it just gets straighter and straighter and straighter over time. And it feels tight back here because these ligaments and muscles are getting stretched to their limit.
Right.
So what we feel we need to do is stretch the posterior muscles here. That actually creates more room for the head to fall further forward. So over time, you see all these people with their heads forward and a big hump right here.
Right.
That's because of looking down too much. So we need our head up over our shoulders where it should be. That creates a nice curve. That creates a nice spongy spring action here. And everything's more balanced that way.
Gotcha.
If you had a weight, Tim, this is 100 pounds. If you held it up close to your chest, you can do that for quite a while, right?
Right.
Now hold it out here.
Oh, yeah. It's a lot harder.
A lot harder to do, right? So even with his big guns here, it's hard to do. So the head weighs a little more than this, about 15 pounds, 10 to 15 pounds, depending on how much knowledge you have in there. So if you have 10 pounds right above your shoulders and supported well, it's easy to hold that. If your head is forward, that's like holding the weight out in front. All of these muscles are going to fatigue a lot quicker, and it's going to feel like 70 pounds, and it's just going to wear out your neck. Pain in the neck, man. So hold your head up high.
Awesome.
And be strong. I'll take that. I know you're probably tired.
Woo!
Probably tired.
I was going to ask you when I could let go of that. Nice. Okay, so what other stretches can we do, like with the lower body?
Lower body. Oh, let me one more to the
Okay.
shoulder.
Gotcha. All right, so let me segue that.
Yeah.
Um,
So that was for the neck.
okay, so what other, tell me about more stretches on this top side.
So we'll work our way down. So the neck is the side to side and all that. The shoulders, we really, because we have so much arm forward posture with working on computers, we really need to open up the chest cavity so that we can breathe better, get better oxygen. So every hour, 10 squeezes up and down, shoulder shrugs. In Tim's case, he goes, I don't know. He does that every hour. Squeeze your shoulders back. That'll help strengthen the posterior muscles back here, and it'll help stretch the front muscles there.
Gotcha. That's cool.
That opens that up.
Okay, that's cool. Those are good exercises. Okay, so is there anything you can do for this part of the body, like this part of the back?
The lower
Stretching?
back?
Yeah.
So again, we usually sit and people slouch, and that creates this low back to be more straight like that. Same problem we had in the neck. That's why we're getting a lot of bulging discs back here. So we need to arch the back. So when you're sitting, best thing you need to do is just put an arch in your low back. If you stick your butt out a little bit or tilt your pelvis, that creates this arch here, and it works those muscles to help hold that curve there.
What about arch supports for
Yeah.
sitting?
So have you ever had a broken bone?
Yeah.
Put a cast on it?
Yeah.
Take the cast off 6 weeks later. You have any muscle tone?
No, it's horrible.
It's horrible, and you have no range of motion.
Right.
So, and it stinks more than what it normally does. So, so braces and supports I don't like for that reason. A lumbar support, it puts you in the right position, but you're not using muscles to do the work. So your muscles actually become weaker over time by using those. So what I would do is set an alarm on your phone, set it for an hour, label it posture check.
Nice.
Arch your low back, do some shoulder squeezes and shrugs, and do some neck stuff. Snooze it for an hour and repeat that. Rinse and repeat, rinse and repeat.
Wow, that's cool, because I've actually heard the opposite from other like PTs and doctors. They'll want you to get some of those like serious lumbar supports, or get a pillow, roll it up, and put it behind your chair.
Yeah.
So what you're suggesting is more of a holistic, long-term approach, because you're actually training your muscles to do the right things, right?
Right.
Okay.
You need to train the muscles, otherwise they become lazy. Muscles are lazy. They really just want to contract a little bit when they have to, and that's it. So we really need to teach them to be stronger and do the work they were meant to do.
Awesome.
You ever look at Native American Indians? All the photos of them, and they were straight upright because they were active. They did the work. They didn't have back braces. They didn't have computers that they looked at, phones that they looked at. They were active, and they were bolt upright all the time.
Nice.
Every photo of them.
Okay, so we talked about different stretches. So let's talk about stretching from like the hips down.
Hips down?
Yeah.
Okay. So one of the easiest ways to stretch is to lay on your back, knees bent up and together, and just let your knees roll side to side. That will actually rotate the low back. Get a nice good stretch in the low back. While you're there, you can lift your knee up towards your same shoulder, and then let it down, and then to the opposite shoulder. My stretching technique is to do a little stretch for 15 seconds and then relax. Do a little deeper stretch for 30 seconds, relax, and then 45 seconds and relax. What you're doing is you're teaching the muscles that it's okay to relax. As I just said, they like to contract. They're kind of bullish. They just want to be strong and contract. Show off for the ladies, but that's not really what they need to do all the time. They need to relax. So if you're teaching them incrementally, progressively teaching them to stretch and lengthen, that gives good support that way.
Awesome.
For the legs, as you're doing the stretch this way, you're actually stretching the quad and doing those things, the kind of the groin muscles as well. For the hamstring, you want to sit up.
And just so we're clear, the hamstring is which muscle?
The hamstring is the back.
Okay.
The back of the thigh.
Gotcha.
There. Do you know why it's called a hamstring?
No, why is it called hamstring?
Because there's a big long tendon in there that the butchers used to use to hang up the string of the ham hock.
That is so gross.
Gross. We'll have to pick Tim up off the floor. So sit with your leg in front of you, and your other leg would be bent at like an angle forward. If you'll hold.
Okay.
You got my back? Yeah. Okay. And what you'll do is lean forward and try to touch your toes. This is what we did in junior high.
Gotcha.
And I sucked at it, but over time, it works. It gets you better and better and better, and I can touch my toes now. So you'll lean forward, come down as much as you can until you feel a light stretch. Hold it for 15 seconds, then sit up and let the muscles relax. They're going to fight you on that stretch for a minute. Relax, and then you can go a little deeper for 30 seconds, relax, and then deeper for 45 seconds.
Okay, that's really cool. Awesome. And that, again, that's for hamstrings and what other?
Mostly hamstrings, some of the low back. You'll get some low back stretches in that as well.
Gotcha. Okay, that's cool. Yeah, we used to do that. You know, it's funny. Things we did in high school and middle school, we just don't do anymore.
We should have kept that up. We would be in better shape.
Yeah. Okay, cool. So let's move on. So Doc, I got to tell you, you're really getting on my nerves. Can we talk about nerves a little bit?
We can. Which nerve you want to talk about? All of them?
Yeah. I have no idea.
So nerves, they have this really cool, they're like electrical you know what they're like?
If we only had an analogy for this.
I think we do. You know what nerves are like? Thank you, assistant.
Oh my gosh.
It looks a little wrinkly. Nerves don't look wrinkly like, well.
It's a giant pig in a blanket.
They might. Pig in a blanket. So nerves are electrical wiring. They have the inner wire, and then they have an outer sheath that insulates them, an insulating sheath. That's what nerves are. So, yeah. And the outer covering is fibrous like that. You want some?
Yeah.
They don't have cheese on them.
Nice.
But this is a nerve, and that covering on there, the sheath, actually prevents the nerves from touching each other and shorting out.
Right.
So we've got tons of them, and really, one of my best favorite analogies, the spinal cord, this real thick yellow inside, obviously that's brain to our entire body is the spinal cord. That's much like the highway, like Highway 75, or if you're on the West Coast,
right.
The Highway 1.
Right.
They call it the 1. So, and then we've got all these little feeder roads off. These are the exits. And then from there, they branch out to the body in specific ways, just like a road map. As you get further away from the highway, the streets get smaller and smaller and smaller and go to different destinations.
Cool. So we've been talking a lot about stretching, Doc. I want to talk about the agony of defeat. You like that?
Nice. Defeat. Yeah. So there's a lot of issues, and what's the main one you hear about?
The main one I hear about, and I've had it myself, is plantar fasciitis, whatever that is.
Yeah. Fasciitis.
It hurts
fasciitis.
right here.
It hurts right there. Pain in your foot. So what happens is the soft tissue of our foot is really mostly just ligaments and tendons. It's called fascia. So itis is an inflammation of that tissue. So plantar is the bottom of our foot, fascia is the tissue, and itis is the inflammation of it.
Right.
What happens is we sit and we sleep and our toes curl in. That tissue gets cold and tight. What happens then, we step on it and that quickly stretches it, and that creates micro tears in that fascia. And then that gets inflamed. The body's like, oh, there's tears there. We need to put a lot of stuff in there to fix it. That's itis. So that is why it hurts so much. So the best things to do are to keep the foot limber before you get going on it. If you've been sitting for an hour, you've got your foot on the floor and just roll up on your toes, roll back on your heel, roll up on your toes, just back and forth for a few minutes.
Okay, so when you're rolling back on your heel, should you reach down and pull your toes forward then?
You can. You don't have to. You can just use your own muscles we like to use our own muscles instead of artificially. So raise your toes up, pull your heel up. That'll stretch the back part, the Achilles, the calf, and then roll forward, and that'll stretch the plantar fascia there.
Nice.
Before you get out of bed in the mornings, do the same thing. Just pull your foot up in your lap, stretch your toes back. You can massage it, go from your heel to your pinky. This little piggy went home. Go from your heel to the fourth one.
So when you say massage, you want to like push out this way?
Push out and
Gotcha.
and you'll feel the tendons. You'll feel the little ropes there. And just pretend like you're plowing a field and just run line by line. Run up and into your toes. You can also then stretch your toes out. That'll warm up the foot before you go step on it. That'll help prevent a lot of things.
Cool. Awesome. Well, hey, I think that wraps up things for today. I actually think we're pretty straightened out. You like that?
Nicely done. Is this going to be on disc?
Nice, very nice. Okay, guys, we will see you. Wait, do you have any more?
Not on me right now.
Okay. All right, we'll see you next time. Back to Balance with Dr. Wooten.
Thanks, guys.